My name is Elizabeth Kraft. I broke my shoulder on November 11th and I went to the emergency room and they told me to see the doctor who had 6 years previously done a total shoulder. And I came home, I called him, it was the weekend, they were gone for the weekend. So on Monday I called, I got a voicemail. I called 3 or 4 times, nothing happened. One of my friends came by, she's a nurse, and she said, oh, I'll call. She called me back an hour later. She said, they don't pick up the phone, it's only voicemail. About 5 minutes later, Marissa calls and introduces herself. And I said, oh God, I'm in such pain, blah, blah, blah. They said it wasn't broken, but. So she said to me, give me the doctor's name and I'll get you an appointment. I said, how are you gonna get through? She said, don't worry about it. 5 minutes later, she called me back. She said, here's your appointment. So then she was following up and the hospital said I didn't have a fracture. I saw the doctor in a few days. He said I didn't have a fracture. I went back in 2 weeks. I said, I can't stand the pain. In the meantime, they wouldn't give me pain medicine. But I had had a rhizotomy to my back, and when I went to pain management, the girl there gave me some extra Tramadol, just in case. Anyhow, long story short, when I went back, the pain was there. He took a panoramic x-ray of the scapula. He said, oh shit. He said, this is fractured. You need a CAT scan. Well, she followed up. I said, I need a CAT. She called, how did you make out? I said, I need a CAT scan. Do you have any trouble? Do you need to get to the x-ray place? Well, my family was here at the time, so it all sort of fell into place. She called, how are you doing? So then right after that, I had a bout with tachycardia and high blood pressure. They found out about that I was in the hospital. They called, do you need transportation? Do you need medicine? Can we help you in any way? Do you have any problems with your house? Are you warm enough? Because it was Christmas and it was freezing cold down here. It was just like, somebody came and we're watching you, anything you need. So when I spoke to my doctor's office, she said, and everything they tell you is true. She said, they will do anything for you. She said, fortunately, you're doing okay. She said, but if you have a problem, they will be there. She said, they'll send a car, anything you need. So that's my story. The shoulder it's still sore, but it's progressing. And I'm just very grateful to have somebody like this call me, because it's comforting. Because he has bad days. He's had 4 strokes, 2 brain surgeries, radiation to his brain, and problems. And some days he just isn't functioning. So it's nice to know that if I'm in a pickle, I can make a call, and I have help. Little people that'll help me or listen to me. And then I got a call last week and they said, are you depressed? They were worried about my mental health as well as my physical health. So it's kind of comforting. Oh, when I get the calls, it's just so comforting because they're not pushy. They ask, how do you feel? Have you had any problems? Are you getting around? One of the calls was, do you have food in the house? Well, I have a lot of food in the house, but I imagine there are people who don't. And just knowing that they're there, and she said, if you need any help, we'll get you to your doctor, we'll get you medicine. Do you have enough of your regular prescriptions? It's just a very, very nice feature. And I didn't know anything about this because before I've had home nursing care, where they came in, they did what they had to do, and they left the piece of people who actually cared, they called. The only thing I can say is I wish more people had the opportunity to have somebody so caring. And the fact that even if I run into another problem, they're there, and they were notified, and they were on the phone right away. It wasn't like 5 days later they called me. When I had the tachycardia, they knew when I was discharged, the call was there. It's just, and I told them all the things they found. I was going to the endocrinologist, the cardiologist, they changed one medicine, reduced another. They paid attention, they really did.